our 8th mission here to Kigali, Rwanda, at the Rwanda Military Hospital that takes care of some of the poorest patients in all of Rwanda, and some of those in the most need. Part of our mission is not only treating patients with major, complex conditions, the same types of surgeries that we'd actually do at home in the most advanced centers, but it's also education. The future is education of the nurses, the anesthesiologists, the surgeons.
Face the Future is a great opportunity for us to learn from them because it brings many specialists, so we learn from them as they do most of the cases that we are not able to do on a daily basis, especially microsurgery and face plastic surgery.
We're really eager to be a great maxillofacial surgeon, and that's why I've been participating the whole of this program to see what is kind of operation that can be possible to save people's life. It helped also me in terms of surgical skills. I've been assisting different surgeons.
And so most of the learning here is really practical. It's hands-on, so it's right in the operating room. But not only are these individuals doing the practical things they need to do, but we're always discussing the reasons why and what other ways there are to do it.
With little child, you can intubate without relaxation.
Yeah.
That means the risk for the post-operative relaxation overhead is very, very slow. Yeah, because it's not necessary to use relaxation for childs normally.
So we learn a lot from Face the Future. They are great doctors, world-class doctors, Dr. Kofi, Dr. Richmond, and many others from whom we learn from. It's always a great opportunity and we never miss it. This is my 4th year attending Face the Future surgical camps. I'm in my 4th year of training out of 5. So little by little we are progressing and learning.
So personally, I gained more technical skills. I've been working with Dr. Holger mostly, and he does most cases of face plastics. I've learned from him the approaches, the decision making, why doing this, not that.
So far what I have learned is that from the diagnostic part, I've been seeing such a kind of big tumors and I couldn't imagine what could it be. So
if you have a subcondylar fracture and the condyle is bent a little bit, I don't fix it. You tell them soft diet, right? Their face will be slightly asymmetric, but not too bad. Basically, there's nothing.
Another terrific thing that's happening here is that Dr. Faraha, who's the chief of plastic surgery, has begun just last year a residency program to train 3 plastic surgeons a year. When we first came here 8 years ago, Dr. Faraha was the only plastic surgeon in all of Rwanda, a country of 13 million people. And as of the year after next, he's going to have 3 fully trained surgeons. We're very pleased, and I guess just a little bit proud, that we've had a role in helping to train these individuals.
In the art of surgery, it is not innate. Of course, you can be creative, but you learn from your mentors.
And so the great thing about this is, not only of course surgically, but also with anesthesia and the nurses, is that these individuals are then going to be able to train, teach, educate the next generation in Rwanda. So we feel it's so important that we're really building capacity here and enhancing sustainability.
The heart attack and the stroke, and then the heart failure, remember? So if the weak heart muscle is trying to pump against a very high blood pressure, that's a weak muscle trying to do very high workload. And if it's trying to do very high workload, it can fail. And if the heart fails, that's what's the most dangerous to the patients. And that's why your job as the anesthesiologist taking care of a patient like this is so important.
This way, our team helps their team not only manage patients in the week we are here, but we're helping them to elevate their standards of care throughout the year.
They treat a lot of patients in a short period. patients that have been waiting for years, months, and they are treated in a week. So it's really an important thing for our community.
In truth, we really are providing hope, one child at a time. We're providing hope, one young patient at a time. Indeed, we're even providing hope to the nurses, the physicians, and the surgeons here. And one can't live without hope.